Frequently comes from tight Achilles tendon or weak foot muscles, which we will see as a recurrent theme with plantar fasciitis, with shin splints, with many things. So, yep. Savage disease. So back here, the Achilles tendon comes down, and right where it inserts is actually a growth plate, an apophysis right in through here. If it gets mad, your life is unhappy. Pretty simple. I mean, it's predominantly in adolescence. Finding some way to cushion the heel does wonders, because it dampens the force that's then going to reverberate through that space. If it gets too bad, it can lead to more of an avulsion, or like where the tendon pulls off of the bone, which is going to be bad, which is kind of sort of what's happening in here. But for the most part, you manage the symptoms. So decrease some of the impacts, give more rest, ice a lot, NSAIDs to hold down the inflammation. There's not a lot you can do here. People will say use heel cups, padding. Superfeet can try with the thicker padding versions of them. But ultimately, none of those do a really good job, regardless of what it is. And you can just tell the kid to hurry up and grow up. So, I mean, the sooner that their growth plate closes, their pain goes away. It's a period in life that we kind of have to work through. But by the time they're 18, like, you'll almost never see a severs issue here at a college level, because they've all outgrown that capacity. So, toe and foot. These are some of the things we're going to cover quickly. Heel spur. We're going to talk plantar fasciitis. Plantar fascia is a triangular-based tendon that goes from the base of the calcaneus all the way up to the front metatarsal of the balls of the feet. And it spans that bridge. So you've got spring ligament, short plantar ligament, long plantar ligament, plantar fascia. Those working together are your static controls for longitudinal arch. Plantar fasciitis is a nasty little booger. That fascia somewhat runs continuous with the Achilles tendon, so if you can actually stretch the Achilles and stretch the bottom of the foot on a regular basis, you typically won't end up getting it. There are some who still do. Your body ends up trying to decrease that pressure, so it starts to grow a heel spur out, which shortens that distance. But now every step you take is hitting onto a heel spur, a bone spur, which isn't going to be comfortable either. So we now have two problems, in that we have an inflamed fascia as well as a heel spur in there. Sometimes they'll go, you can have a surgery, if you can't get it resolved, they'll go in and cut and release some of the bands, which takes some pressure off. Sometimes they'll retract, cut back the bone spur, and then reattach. None of those are fun events. And there's also mixed blessings on how well they work. So how do you manage? Again, I think gastroc stretching and plantar stretching, or the plantar fascia stretching, are the best things. So basically get your foot up against a wall and just lean forward to stretch your calf. And that's going to put a stretch on the bottom of the foot at the same time. More often than not, you can deal with this with orthotics. So if you can get them custom fit arch supports, or even just piecemeal that with some generalized like Superfeet that work, that can help splint it to where the pain can go down. Orthotics are pretty wonderful at helping. Symptomatically, we can do arch tape jobs, which help splint the arch much like an arch support would, or we can do massages. This is phenomenal. Don't do that. Don't. See, this is happiness. Happiness in one.
It's not nice.
These are rollers. It's a very, very cold roller. So there's a gel coating within this case. So you leave this in the freezer, so it gets below freezing. Yeah. So you can just set this on the ground, put your foot on top of that plantar fascia, and you're giving yourself a nice, happy ice massage. Pass it around. And that's been sitting out for an hour now. So that's the warming up version of it. That's $100. This is cheaper, but it doesn't ice. So lacrosse ball. Lacrosse balls are wonderful, wonderful little things. You can use golf balls too, but these are pretty happy in terms of trying to massage them out. So again, just drop it on the floor, take your foot, and just self-massage with your body weight pushing into it. What was I thinking? Oh, another way that's cheaper than a $100 roller is you can take a water bottle, throw it in the freezer, and then you've got an ice roll. Yeah, well, one of those too. A metal container as well, which will give you pretty much what that is.
Could you do grasping as well?
What's that?
Grasping?
Graston?
Yeah.
Graston is a great way to help try to like dig in and release around it, because you'll do that too, won't you?
Yeah.
What about a hand
grasp
massage?
a bit, so.
A what?
I mean, a lot of that to me is symptomatic because you're treating some of the tension, and if you don't figure out the underlying cause. I used to know an athletic trainer who worked in a PT clinic, and he had things worked out with his PT. Frequently, they do a lot of ultrasound to try to warm up the tissue and increase the elasticity. It doesn't work very well, but that's how they would get paid, and so they would do the treatments. The underlying resolution was the fact that they would fit them for orthotics, and so they were getting better from the orthotics they gave them. They were still coming in as it was resolving. For the ultrasound treatment, they thought was doing the work. Yeah, squirrely, but you know. That's why I don't like having to worry about paying for treatments. Athletic training models. So, questions? Good? Excellent? Okay, fine. Morton's neuroma. You have a fun little nerve bundle that runs in. I see it more often between the second and third, but you can definitely see it between the third and the fourth rays right through here. So where that nerve bundle right there gets pinched in between the bones. Exceptionally painful. Every step you take compresses it, making it really, really bad. But you can go in and take kind of a teardrop shaped pad to where when you put pressure, it actually spreads those metatarsal heads out. And in spreading those metatarsal heads out, it takes the pressure off the nerve, the inflammation goes down, the swelling goes down, everything feels better. So, solvable as long as you know what's going on. Positive test is that if I grab the metatarsal heads and squeeze them in, that reproduces the pain. Problem solved. Well, problem identified anyways. Fifth metatarsal fracture. These are a little tricky because of where they get located. So, stress fracture, Jones fracture, avulsion fracture. So, avulsion of what?
Brevis.
Brevis. Brevis goes in right there. Tibialis anterior hits kind of here and here. So we've got the possibility of tearing one of those muscles off. Posterior tib comes up under there. Stress fracturing through here is fairly common. Jones fracture right here. The problem with that is that it doesn't heal very well. It will frequently need to be pinned. And so you need to kind of identify, yes, an avulsion needs to be identified because we need to get that thing put back in place. Stress fracture can heal, but that Jones fracture, if it's just in between those, the shaft, and then where that avulsion would be, you're looking at having a surgical intervention to where you have to get it pinned and set again. Because it has a high incidence of non-union. So, bad news. Liz Franck, these are particularly fun. I've seen this once, and it was a male soccer player who was just playing around, and he misstepped over the ball and then landed with his foot. You get this when you have your foot coming down like this. So effectively, that metatarsal joint right in here dislocates. So this is second, third, and fourth rays have all dislocated off of that metatarsal joint. And you have corresponding fractures at each one of those locations. So exceptionally painful. What's that? That is. It's an awful day. It's a lot of pain. It's really traumatic. It's a pretty involved surgery to plate all that back. It's open reduction, internal fixation. So it's a big deal. So 6 weeks non-weight bearing, 2 months in a cam, a walking boot to where you're putting very, very little pressure on the foot at all. Navicular stress fracture. First question. Somebody point out where the fracture is in that picture. mean, I'll even be willing to put a chocolate truffle on this if you can come up and show me where the fracture is in the picture.
One that sticks in the right.
It's like, hold on. It's right there.
Yeah, it's on the front.
Go point to it. Go touch it.
What? I don't know if it's right.
I think you're right, dude.
Yes, sir.
Yes.
So, navicular, medial, intermediate, lateral cuneiform. And it looks like you've got a whole separate two pieces of navicular. There's a crack
Oh my God,
clean
that's
right
a-
up there. What's that? It has the potential of being non-union, which means it may require surgery. So you need to keep an eye on it. You'll need to get this person off of it. They're out of participation. They need to rest. So it can heal.
Oh, shit, that scared me.
First, MTP, you got turf toe, retraction of sesamoids, and increased likelihood
that's
coming
right.
from jumping. So sesamoiditis. On your big toe, you've got two sesamoid bones under the ball of your foot. The metatarsal phalangeal joint. So these two small bones sit here so that the flexor hallucis longus can run in between. So if you go up on your toes, you're putting your pressure into these small bones rather than crushing the tendon. So that way it's got the room to work. But just like anything else, you can inflame those bones, which means that as you do that, it causes pain.